Hi,
Hello, how are you?
I'm good, Saida. How are you?
I'm fine too.
Okay, I think we should wait for 2 minutes more and then we'll
Yeah,
start.
sure, definitely.
Please bear with my voice.
It's fine.
My voice
It's
is
all
not
right.
good today.
It's all right. I've been there. Just
Okay,
take some
I
lozenges
think we should
and hot gargles.
going through it.
That'll help you.
Yeah. Okay, I think we should start the live.
Yeah, sure. All right. Okay, so hello everyone.
Am I audible to you?
Yeah. Am I audible?
Yeah, completely.
Okay.
Okay, so hi everyone, this is Dr. Diksha Saiwal. Welcome to the Physio Ed, and I'm having a very special guest with us, Dr. Saida.
Thank you.
I would like you to introduce yourself to the audience.
All right. So I'm Dr. Sayyeda Uneza Fatima, and I've done my graduation, that is Bachelor's in Physiotherapy from Jamia University, Millia Islamia, and I was gold medalist in that. And then I did my master's just after that in cardiopulmonary by choice. I chose it. I was getting sports as well, but I chose to be a cardiopulmonary physiotherapist. And I then again became a gold medalist there. I was trained in Metro Hospital along with Primus Hospital and taught by great teacher Dr. S.K. Chabra, who taught us very good, pulmonary medicine and cardiac medicine. And then I got a job opportunity there in Primus Hospital only, and ever since I've been working there. There's an absolutely perfect team there, chest and critical care team, where I look after the ICU as well as the chest patients in the wards and everywhere, and pulmonary rehabilitation and OPD basis also when they come in.
So, what was the reason you chose pulmonary?
Okay, so first, I think in our bachelor's, we are taught enough ortho, like it's like a bread and
Yeah,
butter for physiotherapists.
correct,
Yeah, so
correct.
in our bachelor's, all the postings, all the clinical rounds, and everything related to physiotherapy was about orthopedics only. And very little of cardiopulmonary we were taught. No offense to neuro people, I had no interest in neuro. So that never came into my mind to choose neuro. So that's why I thought, okay, why go into a branch which is already so much saturated, and even a bachelor person can treat low back pain, neck pain, get a certification for manual therapy, and do mobilization. Why not,
Hmm.
explore this new field and get into it, do something great with this particular field. I actually was wanted to, just develop this further. That's why I just chose this.
And this was this field has played major role in COVID times.
Definitely.
So many people.
I
Yeah.
would tell you my
So,
experience. I was
yeah.
in hospital, and the whole hospital was looked after by the chest team only. We were the resident of chest team, the junior residents, consultants, us, the cardiopulmonary physiotherapists, and our HOD, and
Mhm.
only COVID and us, around 200 or 150 patients.
Absolutely. Just rushing around day and night and treating
Yeah.
patients in the ICU. Hats off. So, today we are having a topic emerging role of cardiopulmonary physiotherapist in ICUs.
Yeah.
Like,
So
what is the major role we all are playing in the ICUs?
okay. So first of all, there's a big myth which goes around everywhere that the main role of physiotherapy in ICU is just percussion and vibration. That's all. We don't do anything else, and
Very true.
nobody even is taught
Mm.
about that. Cardiopulmonary is a relatively newer branch, and in bachelors of physiotherapy, nobody is much aware, and we don't even get to post in ICU that much in our bachelors. So no, it's a
Mm.
big no that it's not only about vibration and percussion. We play a very major role. We take rounds with our consultants. Okay, we take care about the mobilization of the patient, that they're timely mobilized, not delayed, so that their lungs and their muscles and their bones, they all stay active, and they do not go into ICU acquired weakness. There's a term called ICU acquired weakness, and it is there for a reason, because in hospital patient lose muscle mass at a relatively faster rate when compared to, outside the hospital or in a home environment. So we have to take care
Correct.
about their
Yeah.
muscular health. We have to take care about their circulation, definitely, their, airways and everything. So we play a major role there. We look after their X-rays. We make sure that they do not develop atelectasis, that is, collapse of the lungs and the alveoli, so that they will further develop HAP, which is called hospital-acquired pneumonia, which with the basic pathology that they have is very deadly. It makes it very complicated for the patient to recover from the
Yeah.
hospital-acquired pneumonia. All right, so that is one major role. DVT, if we see there is any, because let's be honest, the consultants and everywhere, they're so busy with the patient, their charts and everything, they do not have the time to just go and physically assess the patient until and unless it is said or told, okay, sir, they have this problem, and I feel that this is, wrong. They have this, cyanosis or any sort of paralysis. We feel that there is particular weakness of this limb, because sometimes it has happened in our ICU. I was taking rounds in a hospital. Patients were there. The patient was there lying down. Before one day he was conscious oriented. The other day he became drowsy. He was alert, but his whole side, one side of the body was not moving at all. Okay, so I informed sir, and then we got a CT done. So he developed that bleed that time. If only we will notice that, then only that can be done timely and managed timely. Okay, so it is our duty to just go to the
Yeah,
patient,
further
physically assess them.
complications usually happens.
Yeah,
Hmm.
so
Correct,
physical
correct.
assessment is very major role that we play. Okay, and then helping with the weaning and extubation of the patient, taking care about
Hmm.
the NIV, oxygenation of the patient. Like I go take a quick round, look at the oxygenation of the patient. Somebody has put the patients on a face mask on 2 liters, which is not at all, advisable, especially for the COPD patients. Like there's
Advisable.
so many
Yeah.
reasons
Hmm.
for that. So we go and quickly tell the nursing staff to just put them on nasal prong, or they do not need oxygen, just take this off. All right, so these are all the little things that plays major role in day-to-day care of the patient, the health care of the patient. So there are a lot of things. Along with that, when the patient crashes and I'm right there in front of me and the resident are busy somewhere else, we take the command to start the CPR of the patient, because that is basic. It is not
Exactly.
at all, required that you have to be some, even from a healthcare. That is one point I really wanted to add for all the people who are from healthcare or are just normal sedentary people or normal people who are living their life. Do learn BLS and CPR, because CPR is one thing which is life saving, and it can save life of your loved ones when you're just sitting at home. It can happen anywhere. And in India, we are so lacking behind in this era that patient collapses and we do not know what to do. We just take the patient to the hospital, and by the time we reach there, the patient has already lost his life. Only if we know to do the right thing, we can save millions of lives. So that is one thing. And physiotherapists hesitate to perform CPR. Maybe they have not done the certification, so do that. Okay, be confident about it. Practice that on mannequins. In our college, it was there in our curriculum. We were taught with our syllabus. The whole practical thing was done. In our bachelor's also, we were, when we went to get that BLS certification. So along with that, you get the confidence. So whenever the students come for posting from different colleges, I make sure if there is a chance that they can do and perform that, I teach them. I make them do and perform the CPR so that they can develop that confidence that yes, we are also qualified to do that.
Yeah, for that, education is actually important because in the curriculum, I don't think this topic is mentioned anywhere. Uh, Either in any subject we have read, even in the basic ethics and all also,
Yeah.
this topic is not mentioned yet. So
Yes.
that should be educated to each and everyone.
Yeah, in
Correct.
even in school, I would say that this should be added in schools. From 10th standard, you
Hmm.
should start teaching students to how to perform basic life support, choking and CPR and all those things. That is very important.
Right. So what all questions you guys are asking, we will be answering that. Don't worry about it. Somebody has asked, why not 2 liters in COPD patients?
2 liter on facial mask that you give that face mask, na? The basic principle is if you learn about oxygen delivery devices, that mask is not supposed to be given on 2 liters. The range of that face mask starts from 6 liters only and it ranges up to 10 liters. It is there for a very big reason, that is the flow of the mask or the oxygen which is coming, it should go and come back and then mix into the environment when you're exhaling. With 2 liters, the flow is so low that the expired oxygen will get accumulated in that mask. And there is a risk of rebreathing of that CO2. The patient in a COPD is
Absolutely.
already high on CO2. They are, hypercapnic, and you are adding that to them. Okay, so making it worse, not good. So remember always, study, learn the basic. That's why I keep saying oxygen delivery devices are taught in Bachelor's of Physiotherapy 4th year, but nobody is reading that, learning that. How much liters should we give on nasal prong? What is the limit for facial mask? Why we should give high flow mask and when? So these are the basic things, and if you not learn them, you will not be confident enough to go to an ICU or even a ward and when just adjust the setting of the oxygen. So just basic, it's very basic. If you learn, you'll know.
Right. So is it limited to ICU itself, or we can enhance it in, OPD as well? Because so many
Yes,
patients are there which keep on coughing and, they get viral infection along. But I think that basic education and assessment should be there in OPD as well, apart from ICUs, right?
yes, definitely. So, the pulmonary rehabilitation setup, it's there in many hospitals. Like they have cardiac rehabilitation is Fortis Escorts. In our Delhi, I'm talking about. Then we have Metro Hospital from where I did my
Yeah.
postings in masters. They have pulmonary rehab center. So the patients come on OPD basis. From, they come, they
Mm.
do their rehab, their exercises. There is weekly assessment of those patients, of their 6-minute walk test, of their muscle strength. Then an additional load and progression is made. So definitely OPD basis maybe
Mm.
there are a lot of setups who are providing pulmonary rehabilitation and cardiac rehabilitation, which is very important for them. I particularly am focused on working in ICU based setup and
ICUs.
IPD
Yeah,
based
yeah.
setup, but definitely there is plan of enhancing it to in our hospital also. We'll be working to enhance it to OPD basis as well. The patients do come and we teach them what to do and how to do at home, because there are a lot of population who are at home oxygen. You're understanding there are a lot of ILD patients out there, COPD patients out there who are at home oxygen and they need to be told what to do, what not to do. The basic things that need to be done. So, like yesterday only, I'm just telling you, I went to a patient in IPD. He was sitting there and he just complained that, ma'am, you're telling that walk, but whenever I walk at home, my saturation drops till 80. So I asked him, okay, how much liter of oxygen you use when you're walking? So they said, 2 liters. How much is your concentrator limit? So he said 5 liters.
Mm.
When you're walking, your oxygen demand it increases. This is the
Exactly.
basic thing. And the
Mm.
patients needs to be educated. So I told him just before moving up, increase it to 4 liters, wait for 2 minutes so that the oxygen can, there is a little bit of supply of oxygen, then move around, come back, wait for 2 minutes, and then just reduce it to your resting position. Patients don't even know this, and that's why they're not even able to walk at home properly. So you're understanding the need.
Yeah. So, somebody has asked, is there any particular protocol for post-operative patients of any cardio or pulmonary surgeries? Why do you think our role is important there?
Okay, so first of all, our role is very crucial in post-op patient. So when you're talking about protocols, there is no single set of protocol which can be implemented with all patients in any branch of physiotherapy, I would say, not only cardiopulmonary. It is completely dependent on the patient's condition. Some patient will be more active, some patient will be more, enthusiastic, some patient will be depressed, some patient will be a little weaker side on the weaker side. You're understanding, and it depends a lot on their pre-op condition before
Hmm.
mix. So there is no certain fixed protocols. There are definitely things that you should do and progress slowly. Like you cannot add dumbbell exercises on day one of post-op. Definitely not. So there are like rough protocols made, and they're given in a lot of books. I would mention one or two, like ACVPR is there, which is there for both cardiac and pulmonary rehabilitation. Condition wise, it is there. So it is for
So
rough
where there is
ideas.
contraindicated, in which cases contraindications are there for the COP, for the patients of, cardiopulmonary
Okay,
patients, where we
so
can
we
contraindicate?
do not, we will always assess the patient before going. If we see that the patient is a little more drowsier than yesterday, you'll stop and assess
Hmm.
and inform the resident there. They'll get the necessary investigation, don't know what happened. If you just go and start it, you won't know, you can make it worse. So always stop when the patient's GCSs has become poor. Okay, the patient is complaining of chest pain, active bleed, anywhere, hemopsis or PR bleed or anywhere like that.
Hmm.
Okay, the patient's
Hmm.
vitals are unstable. The patient is too dyspneic to even move or stand up. They need first the medication that will stabilize them, then you'll go on with your part. And when we were talking about the cruciality of the post-op patients in physiotherapy, the patients of bypass, they won't even know how to cough if you'll not be there to help them. Because
Yeah,
coughing after bypass is such a difficult and painful thing. And if they'll not do it, they'll develop post-op pneumonia, which will make it all worse. So chest PT after surgeries is very important. Making the patient walk and making them realize that they can walk is very important. You're understanding? The patient will be so apprehensive, they'll be so, in a fear that I cannot move, I just had a major surgery. But you have to make them realize that no, it's all been taken care of. You can stand up, we are here. The patient moves and they feel just excellent. They say it on your face, thank you, doctor, thank you so much. I didn't know I could walk. I was thinking I will not walk again. So, you have to realize your own value first, then only the world will realize it.
correct, correct. The major thing is the counseling and communication skills are very important if the patient is conscious itself, so that he can better understand the things, how things can go further, or else they
Definitely.
always get the negative thoughts that I will not be able to do anything further in life. So that is also
Definitely.
the major issue.
Definitely.
So somebody has asked, is there any particular course for physiotherapy in ICU?
Like I said, there's no particular courses, and stop looking for shortcuts, definitely. The master's in physiotherapy is there, which is specialized in cardiopulmonary. You'll be able to manage ICU, there's ICU management. You'll be able to manage rehabilitation part of pulmonary and cardiac population, IPD part, assessment part, and all these things. Research part as well, if you're doing master's, definitely. So why do you need a particular course for ICU management? Go study, do masters, and if you're very much interested and you're not able to do masters, then go study your bachelor's protocol first. I would say that there are a lot of
Mm,
things in bachelor's only. After bachelor's there's general of everything. In master you specialize in certain things. So study that, get your practice, get practiced under somebody who have that specialization. Okay, then I only advise that you can go for further independent practices, definitely.
somebody has asked, what should be the chest physiotherapy when the patient is on BiPAP?
What should be the chest physiotherapy?
Yeah, what can be given to the patient?
Okay, so since the positive pressure is there, you cannot mobilize the secretion out of the patient mouth. Always remember. So we
Mm,
usually avoid giving BiPAP and NIV in patients who have excessive secretions. You will first
mm,
clear it, and if the patient is already on NIV or BiPAP when you reach there, then you will not just, make them go coughing and huffing. They cannot do that. You just understand there is a pressure of air going in their lungs. How can you mobilize those secretion out? They will impact the secretion further. So we'll not do chest PT when the patient is on BiPAP. We'll make sure the patient is fine. We'll take off the BiPAP. We'll give the patient some rest. First do the chest PT, the limb PT and everything, and see if the patient is fine and okay. Put the patient on oxygen if it is needed, and then we'll evaluate and see if he needs chest physiotherapy or not. And if he does not have any kind of secretions, then you just go for the exercises, the breathing exercises. There are a lot of segmental exercises, chest expansion exercises. Patient is dyspneic, go for pursed lip breathing. There are a lot of, there are a lot of things in chest PT, just not the cuffing, huffing, and
Yeah,
vibration, chest percussion. So that's what my goal is,
correct.
to, make you aware that you have to actually see the patient, what they need. The patient is dry. He's having dry cough. You take the vibrator, you go there, just put there. What is the use of that? Nothing. He does not have secretions in his lung. What you will take out after giving chest PT, percussion vibration. The patient does not need it, so don't give it. Okay. The patient
Mm.
needs some active breathing. Make that. The patient needs some mobilization to walk around so that his circulation can improve. Understanding, so it does not come with just, courses and anything like that. It comes when you learn about some certain
Basic
something.
education and learning skills should be there. And plus,
Definitely.
you cannot keep on reading books and all. There should be, practical things that
Definitely.
every physiotherapist should do.
I would always say that theory cannot go alone. We need practical because our profession is based on practicality. Not only our,
Practical.
all the
Yeah.
healthcare professions are based on practicality. We study, we apply, then only we learn. So that is why when the COVID was there and there was no practical classes, I was just so worried what the students will do. And when they came after COVID to us for posting, I would say it was just very bad situation. We have to teach them from very basic, and they
Yeah.
were very thankful. That is our job, that we teach them.
There was just
Definitely
a
we do.
rush.
Yeah, definitely. It was not their fault,
There was
but
just
they
a
need to catch
rush.
up. Yeah,
Yeah.
they need to catch
Hmm.
up. They have to do it even more. Like, no, we have to do it. We will do even voluntary posting so that we can, get in touch with the patients.
Yeah. Correct. Somebody has asked if the patient is unconscious, then how about chest PT should be there, or what will be the PD positions will be there? So, what can be suggested if the patient is unconscious?
All right, so they'll ask me all about ICU physiotherapy in this live only. So the patient is unconscious, they need you more than anybody else. All right, because they're not
Hmm.
able to cough their secretions out. That you have to figure out how to do that passively. It's not necessarily that you'll do postural drainage or anything. That depends on your physical assessment at that moment of time. If the patient needs it, how he needs. All right, it is not a fix
Hmm.
that put him in position and do it. No, it varies with the patient, like I said. You'll assess the patient, you'll auscultate the patient, you'll check the chest x-ray of the patient, you'll see if he needs it or not. All right, and then only you'll make him do that. And the unconscious patient will not only need chest physiotherapy, just remember, they'll need limb PT as well, and it is very important. You'll have to keep re-examining him every day about any sort of, abrasion or any sort of contracture, any sort of sign of DVT or edema. It's your responsibility to ask the staff or the attendant to get necessary orthos, we have to get the
Hmm.
splints, we have to get the sleeves, which compression stockings to make the patient comfortable and also to reduce the edema. There are a lot of things that you have to think
Lot
about
of
the patient who is
that.
unconscious, not
And
only
it
about the lungs.
depends on condition to condition also,
Definitely.
how
It's
the
not a
patient is
single
going
fix.
on.
Yes, it's not a single fixed protocol. You have to assess the patient.
Okay, somebody is asking what is the future scope for, you
Right.
know, cardio respiratory physiotherapist after masters, they're
Okay.
asking.
So I would say that now I don't know about any other state because I have not been there. But in Delhi, I've seen that hospitals they want somebody from cardiopulmonary only for ICU. Okay? And they
ICUs,
are
yeah.
recruiting the students or the people who have done masters in cardiopulmonary for their ICU setup and for their specific, and even consultants are demanding that. You would not believe because they also know that they specialize in this thing. You're understanding? So they know the whole protocol about the OPD, about the IPD, about the ICU. They are aware about the ventilator, the NIV, the BiPAP, and
Hmm.
extubation, weaning, all those things. So they
Yeah.
know they are something. So that's why they're asking for it. So I would say that definitely the scope is very bright, the future is very bright. Apart from that, as a whole physiotherapy future, I would say is bright. It is taking time. I know a lot of you I get just so many questions about the salaries and everything. Everything happens with time, and I hope that it will also get better. This is one aspect that we are lacking behind, and The
And that
authorities needs to do
also
something.
depends on you, how you are
Yeah,
emerging yourself.
definitely. And there is no, limitation if you are hardworking enough to earn.
Hmm.
You can, open your own setup, put lakhs of investment in that. But if you're not good enough, it won't work. The patient will
It
not
won't
come.
work.
They'll come and they will not come again. Your understanding if you will not
Yeah,
give them quality services. And I know people who are just doing wonders in their own practice, in clinics. They're playing in lakhs and crores, I would say, because they're doing good. They know how to handle the patient.
correct. Okay, next question. We got so many questions now. PT protocol for emphysema in ICU according days nowadays.
Okay, so basically, go study AACVPR, go and practice. There's no fixed protocol, like I said. It's for emphysema and day wise and all those things. It's not there. You have to look at the patient first. What will you do if you just go to the patient on day one? He's fine, sitting normal. You'll make the patient do the exercises. You'll go to the next day, he's all dyspneic and drowsy. What will you do? There's no fixed days in, especially in the lung patient. They are very, dicey. The CO2 increases, they crash suddenly. You see the patient is sitting up
Yeah,
normally on day one, and you see the patient intubated the next day, and maybe expired the third day. You won't know. They are just so, you cannot trust those patients because lungs and heart, they are very crucial organs.
very,
And if they
yeah,
are
very crucial.
involved, then it can hamper. The lung CO2, it directly hampers your brain. It will go out, you will be landed into ventilator. What will you do? What will be the protocol? Then it will become protocol of the ventilator patient.
Well, as a neurophysiotherapist, I'm a neurophysiotherapist, so it is very time consuming. Everything is like slow, 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 slow. We have to go very slow. But in your field, if you're not conscious enough to see patients, then patient is gone.
Yeah, definitely. It's very, unpredictable. I would say definitely. I've seen, like I made a reel also on this thing. From beginning, it has become like this. The patient will be talking, walking, and doing everything on day one or two or anything. He will be planning to move the patient to ward, and the very evening, the patient expires. You don't know, especially in the case when the heart also is
Yeah,
also involved, and the lung and heart, they are like
involved.
this. You see the picture, the lungs and heart, they're together. If
Absolutely.
the lung is hampered, the heart will also be, compromised. So you don't know.
If we study heart, then it is related to, if we have studied on physiology also. If we study
Yes,
heart, it is related to lungs as well. Correct.
definitely. Heart will hamper lungs, lung will hamper heart. So they're all,
Heart.
relationship together. So it cannot go anywhere if their lungs are involved. So definitely it's very unpredictable. But yes,
Okay.
we see that the patients do recover also, they go home also, and they get better also.
Mm.
It's both ways.
Yeah. So, can you suggest some of them have asked which college is the best for PT pulmo cardio?
Okay, so I would say ke from Jamia Millia Islamia, I did my MPT cardiopulmonary. The teachers are great here, definitely. One of our head of cardiopulmonary, unfortunately, Dr. Jamal Ali Muiz, he expired last year only.
Hmm.
So
Oh,
after that, it has become a little, difficult to manage the cardiopulmonary in our department. But it is great though, Jamia Millia Islamia. But you can also go for this Jamia Hamdard, that is also there. And also ISIC is good for neuro, I think. So I
yeah.
think these two colleges are quite
Hmm.
good for MPT cardio. You can go and look for them. Okay, and you can also look for new colleges because as far as the new private universities or other things, I'm not well aware about their PT cardio and their, this thing, how
Because
they are doing.
now most of the colleges are included in NEET also.
Yeah.
So they have to give the common exams to, get counseling, and after that only they are selected to the specific colleges.
Yeah, so that's why I don't
Okay.
have this thing.
So somebody has asked effective mobilization of obese patients in neuro ICU. Well, this is not the neuro theme right now.
Definitely not my best, especially.
Yeah. Whenever we will be doing neuro, then
Yeah.
Definitely we'll be discussing about it. Okay. So suggest books for cardiopulmonary rehab.
Okay,
Any
so I,
suggestions?
yeah, definitely. So basically, I suggested in my one of the stories as well. Previously, it's been asked so many times. Just write it down this time, everybody. And I think I'm going to put it on my highlight also. So just studying the
Yeah.
basics of cardiopulmonary, you can go and study from Front Filter. It's Donna Front Filter. It's a
Hmm.
good book, and it is specially for physical therapist. It is written from the point of physiotherapist only, and it's good book. It's
Hmm.
quite thick one, but it is good, and you must learn it. And they have just mentioned everything from the equipments, from how to deal with them and everything. So it's a very good book. For bachelor students, I would suggest this. You should study this. Then we have an Indian author also, which is Pryor and Prasad. They have mentioned techniques quite well, like the PNFs and the like secretion mobilization, chest clearance techniques. They are all good in Pryor and Prasad. Then we have Cash and Cash, which is for postural drainage. Like it's kind of pocket book. You can just keep it and for quick review of all those things, right? Then for specific rehabilitation condition based, we have AACVPR, which is both for cardiac and pulmonary rehabilitation, which is like specific to the conditions. But you also have to make sure that you see the patients. Without that, you cannot just go by the books. Just remember, see the patient, assess their condition, then only apply anything that you want to apply.
So, one more question. One has asked, as a physio, are we allowed to perform PFTs?
Yes, why not? What is like a deal with performing PFT? Like we are taught in our bachelor's and in master's also how to perform a PFT test. So why not we perform it? It is just completely normal. It's not a very big test. We perform PFT, we perform CPET, we perform, 6-minute walk test, RMT, all these things, and these are like normal tests. They come under our curriculum. So remember that. And before asking any of the questions like this, go study your curriculum first. What is there in it? What we are allowed to do? Many of you don't even know what is there in our curriculum. Okay, EMG is there.
Yeah.
Okay, we do researches on EMG. Okay, we have our EMG lab set up in our this college. There are students doing master's thesis on that. There are PhD thesis on that. So we are eligible to perform EMGs. We are eligible to perform HRV. They're all things which we are taught, we are doing, and we are allowed to do. So remember this.
Yeah. I'm so sorry.
That's
Got
okay.
a call. Okay. Okay. Last question. Yeah. So somebody has asked pediatric chest PT and adult chest PT. What is the difference and what other things can be done in pediatrics specifically? What can be done?
Okay, so I would say that is not my specialty at all. Okay, because I have studied about the protocol in my master's, but I have not dealt with pediatric population in any of the posting in any of the my job. I am completely into adult chest physiotherapy, so I would not comment on that because I do not know about it. It's not in my domain. Yeah, yes, definitely I can study that and put a post on it, but definitely that need to be dealt in practicality as well. It has to be compared with the practical aspect. Then this also I would like to say to all of you, always remember what you know. Don't always say yes, 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 I can do this, I can do this, and make the condition worse. Always follow the referral culture. If you are not, qualified enough and you do not know what to do with the condition, just refer the patient to the specialist. It is always best for the patient and for you as well. It is not necessary that you can do everything with the physiotherapy alone. No, there are specialties for a reason. So always, you know, adapt that.
Okay. So I think so many questions have been answered now. And rest all you can, spam Dr. Saida ma'am.
Definitely. Okay.
And I always see your posts. They are very, informative. I
Thank you
really
so
love
much.
them. and I hope people are also following it really well. So hope you all got all your answers, and thank you so much for joining and giving all of them about, cardiopulmonary physiotherapy.
Yeah, thank you so much.
Okay, then see you next time. Hope to connect
Yeah,
with you soon.
thank you. Okay, bye everyone. I hope that I answered your questions and we'll do something again in our next sessions definitely. Okay, thank you so much. Bye.
Bye.